Another exciting edition of ESR, where we celebrate the strength of a woman, where we lift up women, where we, offer a shoulder for women to cry. We support women, women supporting women. That's basically what ESR is all about. And join me live in the studio with Madam Jochebed Ambe, a neurologist, I think. Yes, a neurologist. You're welcome to the show.
Thank you, ma'am. It's a pleasure to be here.
Welcome
today.
to ESR.
Thank you.
Okay. And we have Madam Delphine Agbrsangaya, my sister from Manuland. You're welcome to ESR.
Thank you very much. My pleasure to be here.
Always a pleasure. You're welcome. You're all welcome to the show.
Thank you.
And we'll come back after a music, the jingle. We'll come back after the jingle break. Welcome back. Like I said, it's ESR, where we celebrate the strength of a woman. And today we are talking about autism. Now, living with autistic children, what there is to know. What do you need to know when you live with an autistic child? Now, this has been triggered by the story of somebody. I have a friend who has a younger sister who has an autistic child and does not know how, like, she has the denial syndrome. She doesn't just want to believe she has an autistic child. She doesn't know how to handle this, the situation. And of course, today, that is what triggered this topic for today. And of course, we have with us our experts who will be talking to us on how to deal with autistic children, what you need to know. Now, Madam Jochebed, what is autism? When we talk of autism, what do we mean by autism?
Okay, autism, I'll first of all say, is not a disease. It's not a sickness. Autism is a kind of developmental disorder, that some people may have. Usually starts from childhood and it persists to adulthood. And it's actually a disorder that affects a person in three major ways. First, in the area of communication. So the person has issues with may have issues with verbal communication and also with non-verbal communication, And the second area actually is in the area of social interaction. The person has difficulties, or the child has difficulties in interacting socially. And then the third area is you'll find a person having some kind of restrictive or repetitive behaviors. And I would say that autism, one person having autism is different from another person having autism, because it's a spectrum. When we talk about a spectrum, it's like it depends on where you find yourself in the spectrum.
So does that mean that it manifests in different children differently?
Differently. Okay. No two persons with autism are the same.
So at what age can you detect the fact that this child is suffering from autism?
Usually from childhood, some people may see some signs, even from birth or from 3 months or 6 months or 9 months. But diagnosis, the time that you really see visible signs is between 18 and 24 months.
After birth?
Yeah.
So it's not even possible that, okay, now we know that when you're attending antenatals, you do at least 3 ultrasounds.
Yeah.
And sometimes even more, especially if you have some complications. Now, is it not possible that during your antenatals, when you're carrying out your ultrasound, is that not possible? Like sometimes you go to the hospital, some complication, and doctors diagnose that, or they diagnose that you have the fetus has some defects, and sometimes they even advise some women to go to abort.
Yeah, it happens with some conditions, like Down syndrome, that you can detect when the baby is still when it's still a fetus, but it's very difficult with autism. It's actually after birth, But
okay.
I read an article. I read an article about the fact that actually autism actually starts before birth. It's just that the signs now, is actually after birth.
Okay.
It's very difficult to dictate it when the mother is pregnant.
Oh, okay. All right. So what are the symptoms? What are the symptoms of a baby having autism? How do you know that?
Okay, like I talked about communication, let me come to the area of communication. You would find, for example, you know, verbal, like when I talked about verbal communication, most children with autism may not really communicate with you verbally. You know, they have challenges of, and it's not like they don't hear. You know, when we talk about communication, you have the receptive communication and the expressive communication. They will actually hear you, but to speak out sometimes, you know, is maybe challenging. Some of them really do have words, you know, but, you know, their word, you know, and then some of them may not have words at all, but it's not like they don't understand you. And then the area of gestures, you know, like when you speak or when you want something, you can point to something. But people with autism is difficult. I mean, like children with autism, it's very difficult for them to point, you know, to what they want, you know, and all of that. So, and they don't really understand emotions, you know. You know, when you have emotions, you have this.
You have to communicate.
You know, they may not really understand that. So, in the area of social interaction, some of them don't really have eye contact. You know, if they're talking to you, you're talking to them, they don't really have eye contact. And sometimes they behave as if they don't hear you. Whereas they really hear you. You know, you call their name, sometimes they will not even turn. They just like to be in a certain corner, withdrawn. You know, they have this this attitude of just being alone, you know, and sometimes they would play alone all by themselves. You know, if you give a toy to a child with autism, you know a car is something that you know how, you know, you can play with. A normal child would just, or let me not say a normal child, I would say a neurotypical child would play with a toy appropriately, but a typical child would kind of or let me say a neurodiverse child would kind of
do things orderly,
line up the toy and just maybe just stay in one place and is doing the same thing. Or there's this repetitive behavior of rocking.
Okay.
You know, some of them just rock, you know, just rock, or they spin on they flap their hands, or they make some same kind of noises all the time, you know. So you have those kind of behaviors. Sometimes you come to a child, a neurotypical child, where you want to carry the child will lift up their hands like ready to be carried.
Carried, yeah.
But a neurodiverse child, I mean, a child with autism, there's no response, you know. So those are some of the signs.
Can we say that it affects their brain as well?
Yes, it's actually the brain. That's why they call it they have an issue from the brain, you know.
Can communicate.
Yes, yes. Yes.
Thank you very much. I'll come back to you. Now, I'm just grateful and thankful that I have a mother, a woman who has an autistic child. So you can break that myth out there. Like I said before, I have a friend whose younger sister has an autistic child, and she has no idea how to go about raising that child. She can't even give that child love. She sees it like an ill omen. I just want you to give, just tell us your journey. How do you cope? How do you manage with your child? You said the child is 5 years old. Yeah.
Yeah. Having a child with autism is really challenging. But what I want to say is that when a mother is pregnant, you don't know what kind of child you will have. Your expectation is, you know, it's filled with joy the day you see your child. But when this child comes and you realize that the child has a disability, I don't think it's a reason for you to feel stressed or frustrated. You need to thank God for that gift, because
of life.
You know, it is life. A child with autism at birth, you don't see any deformity in the child, so it's a normal child growing up until when the child starts hitting some milestones and they are not meeting the expectations that you would have noticed maybe in another child that you've had. So for my own case, for me it has been an enriching experience, because I've learned a lot from my child, and what I can do today is to encourage other people
Parents,
who have children
with
living
autism.
with autism or other disabilities. What you have to do, first of all, is to know exactly what your child is suffering from. Yes, you know what your child is suffering from, not from rumors. Don't allow the family and friends to talk you through what your child is suffering from. A mother should have a pediatrician for their child. So when you take your child for routine checks, and if the child is diagnosed with autism, you need to find out more what autism is all about. What do I need to know about this condition? How do I help myself? How do I help my child? And if you know how to go about it, then it becomes easy to
less
handle
stressful.
the situation. The wrong thing to do is to deny. If you are ignorant, it is different. But when you know, because usually what happens is people start observing your child, and they start telling you it's like this child has this or that. You go and get help. First, like I said, get the pediatrician, diagnose your child.
From the right quarters.
From the right quarters. And you handle your child like you handle any other child. In fact, a child that has a disability is the one that deserves more attention. So that child deserves all your love. Like Madame Jochebed just explained, it's not like they don't know, they don't have feelings. They have feelings, and they know when you love them. You need to love your child and also sensitize your environment. People should know that your child is different. You need to create some awareness around you. Once you accept it and the people around you understand the condition then
of the child,
life becomes even easier on you.
So what are some of those challenges in raising your 5-year-old child? What are some of the challenges as a mother that you face?
First of all, the fact that the child doesn't have verbal communication. The child can't tell you when they are hungry, or if something is disturbing them. It is difficult. You need to detect, you need to observe, you need to monitor your child, and try to imagine what they can be going through at certain times. And then the child's security is of so much concern. Autistic children don't have any sense of danger. They can run to the road. They can jump out of the gates at any time.
So you need constant,
they need constant
attention. Monitoring.
If you are not in the house, then you need someone who is there and who is paying attention to the child. They can pick up anything and drink. So you need to watch your child closely.
Constantly.
Yes, and make sure that you don't leave them around persons who are careless. You need to have someone that can take care of your child like you, even if they don't do it 100%, but a certain degree of confidence. You should have some confidence and patience. You should have patience. That word patience is something that I thought I knew the meaning of patience, but since I had my child, I have learned how to be to be extremely patient. Yes, you have to be patient with your child. Now, how they feed is another area of challenge. Autistic children are very choosy. They are very picky when it comes to feeding. Yes, when it comes to feeding, they might like some particular foods. Others they don't want to see. Now, this is a child you're raising, and you want to make sure that their diet is balanced, because even that feeding is part of their therapy, part of their wellness. So you need to know the tips to use to feed your child and make sure that they get the nutrients that the body needs. So that also is another area of challenge. But once you get it, once you get it, then you start seeing some gains in your child, and It's so heartwarming.
Yeah,
yes, it's so heartwarming when you realize, when your child makes just a little progress.
Yeah.
Like the day, you know, I used to take so many things for granted. So many things for granted until I realized that for a child to call you mama,
Oh.
it
melts your heart.
It melts your heart.
It melts the heart. We all experience that.
Yes.
Yeah.
So you're waiting for that day that your child will call you mama. So every day you are reading your child's lips, like, is he going to call me mama today? And
for you to know, to assure you that this child identifies in, she knows that this is mama.
Yes.
Oh.
So that day, when that day comes and your child says mommy or mama, oh my goodness, you feel like relaxing on a sofa,
you know that
and
you have
saying,
done it. God, I thank
I've
you.
achieved something. God, I thank you.
Oh, that's so sweet. It's so inspiring to hear your story. And I was just so happy that, you know, you indicated that you were coming, so that most of the mothers out there with, you know, this autistic children should know that it is not a curse, because most of them think that it's an ill omen. It's bad luck. You know, it's surrounded with a whole lot of myth, a whole lot of stories. Like you said, in the quarters, you have a child like that, and people start telling you, no, go and see this Baba, go and see this person, and, you know, people don't know where to get help. And I think that if you're following, you should, you know, I think this is very educative, and people can, you know, they learn, you know, they know where to go to.
I went through this kind of experience where someone comes to you and he says, take the child to the church, go and meet the man of God, take the child to the village, let them pray on the child. And I smiled because I knew about autism. Yes, before having my child. At least I had an idea. Yes, so with this one coming into my life, it now pushed me to really go further and understand what this condition is. So I didn't fall for all those, you know, cheap advice, pieces of advice. I went to the doctor and he told me what it is, and I am following it up strictly. My child is in school. I bet you that these children have potentials. They have potentials. You just need to follow up your child. If you follow up your child, you'll be amazed. You'll be amazed by what they can do. Yes, you know, it's not like they are foolish. No, they are intelligent otherwise. I tell you, if you put fire here, my son looks at it, he knows that he shouldn't go.
Danger.
Yes, he shouldn't go around. But this has come along with time, working with him, being patient, and applying all the pros. Advice, pieces of advice from the doctor, from the school. He is a pupil in Nora. So they give me feedback about my child's performance, what I need to do.
Is it a special needs school?
Roa, it's a school. It's a mainstream school that has a department for neurodiverse. So my children are in this school. So the neurotypical one is there, and the neurodiverse one is there. So this is
that they can always keep an eye.
It's a wonderful center. It is a wonderful center, and I encourage parents who have autistic children or children that are living with other disabilities that they should find out about this institution, ROA, Ray of Hope Academy. It is situated in Denver. They are doing a marvelous job. I bet you they are not only handling autistic children, but you have children with other disabilities there, and you'll be amazed by what these children can do. Sometimes they have events in the school and they invite us, parents, to come. And I see what these children do. They plant, they build, they do some handwork. These are things that when you are at home, you wouldn't believe that your child can do. Yeah, sometimes they send me videos of what my child is doing in school. And I'm so, like, you know, like a few days ago, my child's teacher told me that, Madam, your son has started mimicking some sentences, very short ones. And I was like, no, please, let's keep it for now because I plan to celebrate. You understand?
I know.
So, and this is true because I'm saying it at home. Had it been, I listened to what they told me in the quarter, my child might be in the village suffering, being tortured, my beautiful child. But my child is
thank
doing
God.
my child is doing well.
Yeah.
My child is doing well.
That's the essence.
Yes,
That's
and
the
I know
essence.
it's just a matter
Of
of
time,
time. Yes,
yeah.
because I am on his case. I'm not going to give up. I'm using all
That's very
what
good.
it takes to help my
Build
child.
him up.
Yes, and help every caregiver around him.
yeah.
Yes, just create that awareness. Let them know that he is different. If you want, this is the way you can manage. Your child. Yeah. So for mothers out there who are hiding, or who are shy, or who are timid, or who are ignorant, I feel sorry for them. They need to speak up, because they say a problem known is a problem
solved.
Half solved.
Yeah.
If I don't know that you have a headache, I wouldn't give you medication to relieve your headache. So come out, say what your child has. Speak out. And there is somebody, believe you me, it took a church community, a friend, a mother in the church to know that my son has autism.
Wow.
Yes, for her to recommend Ray of Hope Academy too.
Okay.
Yes, I didn't know about this. I put my son in a regular school, in a mainstream school, and the complaints that were coming from that school, I bet you, I couldn't sleep. At my job, they would call me, your son is doing this, he's doing that. I will rush to the school, I will pick him up, I will go back home, take him back to school. It wasn't easy.
I can imagine.
But since he is at Ray of Hope, believe you me, when I have phone calls,
you can sleep in peace.
I sleep. When I have a phone call, is to tell me good news about my child. So if I hid it, I wouldn't have been where I am today.
Had the help.
Yes, I had help because I spoke, and somebody heard me and said, okay, let me contribute. So it's important to speak up.
Yeah.
Yes,
it's very important to speak up. Now, how is his relationship with his other siblings and maybe the other people in the society?
Okay, I will talk about the before and after. Okay. Before now, it was really like he was living in isolation. You know, even at home, he will want to go to his room and stay there and play in his own little corner and don't interact even with his siblings and other family relations. That
does he recognize the fact that those are his siblings?
He does. He does, because from time to time you will see him going to give a hug. He likes kissing. Most autistic children do that. Yeah. So for now, he has greatly improved, and that social interaction is there. He plays with everybody that comes to the house. I don't remember the last time I saw him running to go hide in his little corner. If there are toys, you know, he wants to pick them up. He knows how to use the toys, and he plays. He plays normally. He cries when he has to cry, but he doesn't really cry. He enjoys laughing, running around, and he's a busy guy. You know, he's busy.
He doesn't face bullying in school?
No, he doesn't face bullying, and that's why I said you need to put your child in the right place. Yeah, so he is at the right place at the right time. He doesn't face bullying because there are other kids like him, and even the ones that are in the mainstream section understand that these ones have special needs and they know how to play with them. But if you take him to an environment where they don't know anything about autism, they don't understand this kind of disability, it might be a challenge. Difficult. Yeah, it will be really, really difficult.
Okay. Now, let's just go back. What actually causes autism?
That's a very good question, because like I said, autism is not a disease. So it's not like malaria that you have it through maybe a mosquito bite, or typhoid that you have through maybe bacteria infection and all of that. Autism is actually an issue with the brain. And there are some causes of autism that have been, they're like speculations, that's still like speculations, you know. Scientists are saying it's from the genes, you know, or before coming to the genes, maybe they're like environmental factors, you know, that has kind of caused mutations in the genes of parents of an autistic person, or came from the grandparent or from one of the ancestors and all of that. So they link it to genes, to environmental conditions, to intoxication from hard metals, you know, even like lead poison. I don't know if you've heard of lead poisoning. Most paints that we use, like paints we use to paint our houses, some of them have
paint.
Yes,
as in normal paint.
Yes,
okay.
They have lead, you know, and lead is not a very good metal for the human body, you know. So sometimes they will advise people to not use paint that has lead, because lead always finds a way of getting into the human system, and it's really, it helps in changing our genes. It affects, you know, your baby. It may affect you in one. It also it can cause cancer and all kinds of things. So all of those things are just, they are speculations, you know. They are still, there's no really like this is the cause, and some of them is linked to the fact that maybe mothers, maybe when you're pregnant, you are exposed to, or you drink lots of alcohol, or you're exposed to hard drugs and all of that, you know. So it affects your baby, it affects the fetus, and when the baby comes out, I mean, when the baby comes now, maybe it affects the brain of the child, and then the baby comes out autistic and all of that. So there are lots of those speculations.
Okay. Now, if you have a child and he or she's diagnosed with autism early enough, is there a possibility for him or her to be treated? Can they treat it?
Okay, I would say you cannot cure autism, but treatment for autism is actually therapy.
Okay.
You know, the child needs to go through a lot of therapy.
It's not like a situation where you take medication.
Yes.
They are not on any drugs.
No, there's no medication that will cure autism.
Okay.
That's why we always encourage parents to do early diagnosis, you know, because early intervention is the key. You know, why early intervention? Because the brain of the child is still plastic.
Okay.
You know, because what are you trying? What is therapy doing? Let me just let me first of all talk about the therapies that the child will need. You need speech therapy. You know, at a certain time, you will not give speech therapy to a very young baby, because usually they still have to you know, speech therapy. They need occupational therapy because they need to function. Sometimes they have issues with their motor skills. They have sensory problems. You know, like if an autistic child comes here, sometimes you see the child covering the ears. The sound of the aircon is really loud for them. So sometimes they have what they call sensory overload. You know, when they're in a noisy environment, they just, you know, that's why you see them, they can start throwing a tantrum because that place is too noisy for them, you know. Or some of them don't like to be touched, you know. So, so occupational therapies actually help these children in that area. And then you have physical therapy. Some of them need motor skills, you know. So we have ABA therapy. Is actually like the behavioral part of it.
On ABA, what is that?
That's applied behavioral analysis. So it's a way of actually, you use like, let me just put it in the simplest form, reinforcement, you know, like a positive reinforcement or reinforcement to kind of extinguish a negative behavior. You know, let me just give an example. A child, an autistic child, you may find a child always kind of, you know, some of them, when they get frustrated, maybe they bite themselves or they bite others and all of that. You know, you need to find a way to help the child from that behavior. It's a negative behavior, you know. So if you notice that a child likes a particular thing, you know, a child likes a particular thing, you know, what you would do is you will use that thing that the child likes
to distract him,
to help him, you know, to kind of pull him away from that behavior.
Thing,
you understand? Or if he's biting himself, you find out what is causing this child to be angry until he's biting himself. So find that thing that triggers that behavior and take it away. You know. So ABA is a lot of it has a lot of dynamics, you know, And that's one of the therapies, that's the core, that's one of the therapies that really helps children with autism, because you have to focus on their behavior. You know, if sometimes they just want to run around and not really sit and maybe focus on a particular task. You look for what the child likes. Thanks. You know, to draw the child's attention. You say, okay, first do this and then this. You know, since the child would love to do that thing, I mean, would love to do what you want to offer, like the reward, you know, the child would want to. It's not like they don't want to do, it's not like they cannot do the thing, but just maybe because their mind is that I want to do something else. So they'll be able to sit now and do whatever task you have assigned them to do. And then they'll do it, and then you make sure you reward them like you promised. Because if you don't reward them, you're actually encouraging the negative behavior more, because the next time you will not do what you asked. Yes. So, and so that is it about ABA. You know, you have like in school now, we also have educational therapy. Educational therapy is actually like finding different ways to help have a child study, like maybe the child's curriculum. If the child has to study numbers, you know, you have to think about the child's strengths and weaknesses. You have to look at the child's strengths and weaknesses. Can this child sit for long? Some of them have very short attention span. So you make sure that you don't give them long activities. For example, you know, if the child has to maybe do maths, maybe write from 1 to 10, you know, the child has a very short attention span. Okay, now say you were going to write maybe just 1 to 2, then I'll give you 2 minutes or 1 minute, you do something else, and then you come back and write. So you have to be very patient with them.
Super patient.
So that's actually treatment. Treatment is not any medication. It's actually therapy. It's actually therapy. And once you do that, since these children like routines, you know, when you keep doing this, there's this consistency. You have to be consistent with them, with whatever method you're using. Since they like routine, you start noticing that they'll start enjoying it. They'll start doing whatever. I mean, when they come to school, for example, if you are very structured, they come to school, they know that they have to put their back here. Okay. And they have to sit down. The next thing is that they have to, maybe this is their schedule, they always know. The next thing, maybe they have to do fine motor activities, maybe sorting of objects or something. Or the next time, or the next, after sorting, maybe they have to do another activity, all of that. You will discover that when you structure like that, and you will discover those stats, you know, their body is already wired that way. In such a way that we notice that even when it's break time, the children know, even if they have not looked at, they already know, because their body is already wired that way, you know. When it's closing time, they already feel that it's already closing time. I think so more, like a mother, you would notice that even sometimes these babies, they know even when they have to bathe, they already start feeling it. When that time reaches, don't give them that bath they want to, you know. So that's how these children, that's how you have to be structured, you know. And when you start when you do that, you start seeing some changes in them.
That's okay. Now, do they have normal teachers, or they have particular teachers attending to them? Okay,
I would say that children with autism or other disabilities actually need special educators. Special educators are taught differently. You know, first of all, as a teacher, you have to be first of all patient. You know, special educators offer what we call clinical teaching. I want to put it that way. What is clinical teaching? When a child comes, when you notice that a child has difficulties, or the child has a condition, maybe autism or Down syndrome or intellectual disability and all of that, you have to start with observation. You don't just jump and you're teaching the child. You have to observe the child, because every child is different. Every human being is different.
Of course.
You know, you have to observe the child. What is the learning style of this child? You know, what are the strengths of this child? What are the weaknesses of this child? What are the interests of this child? You know, you have to do that observation. You know, when you observe the child, you know, I'm talking from the part of the school, right?
Yes.
When you observe the child, you know, you also, you know, if when you observe the child, you kind of come up with a program. You have to do an individualized program. But normally, doing an individualized program is challenging, but it's worth it.
I have a problem. Now, we are talking about the African context where we really don't have those, you know, experts here.
Yes.
Now, sometimes you find a child, it's because she opened up to somebody that she could get the help that she needed.
Yeah.
Now, we live in a society where these things are not, people just know that it's ill omen, you know. You don't want to get help anywhere. And then, now we are talking of a teacher. You go to school and he doesn't even know that this is what this child is suffering from.
Yeah.
Or you are not even experienced. You don't have the expertise to know that this is what this child is suffering from. Because now I want to take our continent and the Western world. There they know these things and they have like specific teachers who teach these children.
Yes.
Don't you think that in our society, in our context, it gets a bit difficult because you can't find those people readily, you know, to teach this our children?
You're very right. It's very difficult because we don't have lots of special educators. Because, like I said, to teach children with disabilities, you need special educators because they are taught, they are trained differently.
Yeah.
You know, a general room teacher may not be able to do that because you're taught to like teach children in a classroom, and you expect that all the kids are the same. You have to use the same curriculum.
Yeah.
You know, you don't care whether there's this one that has this issue or the other. You have to grade them in a particular system and all of that.
That's where patience sets in.
And that is why when you're dealing with children with special needs, they are taught differently. That's why I talked about their individualized programs. Because you're teaching, I started by you observe the child. And then now through whatever you've observed, you know, you come up with an educational plan for the child. Yeah. Usually to come up with an educational plan, you need, it's a whole team, it's a whole, you have a team of experts that work on it. But in our society, we don't have those experts. And most of the children that we have in our schools, they don't even have a diagnosis. So you will not even, you can't even bank from the diagnosis and say, and even add something. So you have to do it from what you've observed, you know. And then now you have to be patient. If it's a child that needs more time, you give the child the time. You don't rush with the child. You know, the child's individualized plan is for the child. And you don't rush over it because you want to catch up with the curriculum. It may take years for the child to pick up or to progress. Imagine we have children that it took us maybe 1 year for the children to be able to know one color.
Wow.
And you don't have to do it in one setting. You don't have to just sit in classroom and just teach and all of that. You
let them out.
You change the setting, you change the format, you know. If I'm teaching red, for example, and I see that this student is not getting it, you know, I need to keep insisting. Maybe I do him a red bracelet. I tell mom in the house, just put red things in the house. Maybe if he has to go to the fridge, there's something red, let him see and say, hey, this is red. You know, keep saying red all over, you know. You can ask that maybe his back is red or something so that he gets used to the color for a while. It takes time. Yeah. You know, it takes time for some. So you have to think about time. You also have to think about the content, you know. If I have to talk to an autistic child, I will not use very long sentences. You know, I will not expect him or her to tell me a very long sentence. A child that is non-verbal, who cannot really, you know, express himself or herself. You know, I would say, okay, I will not say, go to the kitchen and bring me a bottle of water. I will just say, water, please, or water. Water, bottle, water, you know, water. You know, and when you're saying that, you know, the word is being registered and the child is able to capture. But when you put in a very long sentence, it may be very difficult for the child. He loses it. Yes, he loses it. And if you have to give instructions, it depends on the level of the child. There are some children that can take one step, some can take two, some can even take more. If you see that your child cannot take more than one step of instructions, you just make it one step. Don't say go to the bathroom and take off your shoes and come back. You know, that would be too much for him. You know, that'll be too much for him. You start by take off your shoes. You know, that'll be too much. And then the more he starts understanding, you start adding another step. So you have to be very patient. You have to be very patient and love them. You know, understand, accept them, just love them the way they are. Yeah.
Wow. Okay, back to you, Delphine. You're a working mother, full-time working mother. How do you balance work and this child who needs your attention, constant attention, like every day? How do you balance that?
Yeah, it's really a challenge, but I thank God too that I work for a company that knows about work-life balance. Okay. First of all, the company is a company that works with the heart, so they can easily understand when you ask for permission because you have an emergency. But I think it really has to do with how you organize yourself. And you know, children with disabilities, I can say they are on different spectrums. There are some that are really severe and there are some that are mild. And for my case, my son's case is mild. Yeah. So he functions almost like a neurotypical kid. Yeah. So I just have to make time to make sure that he's dropped and picked up in school. And there are possibilities. You can use the school bus, or you get a driver, or yourself, you create a time to drop him off in school, and then he comes back at the time when the others close, and then we meet at home when I get off work. Yeah, it's true that sometimes he will need extra time to go for therapy. If he has to go like for the speech therapy, you need to create time for that. But that too, I put it on days when I know maybe I'm off work, or we do it more during the vacation, or we can use the weekend so that it really doesn't get into my way.
Yeah. And sometimes you think that you can get used to some of the things that they teach him so that you as a mother can do that, you can help him at home?
That's just the way to go, because with autistic children, you need to insist. You need to do things over and repeatedly for them to capture. So your child's education is in your hands as much as it's in the hands of the educators. So you need to know what they are doing in school and try to replicate at home. And not just you, even other people living in the house, they need to understand the child's program. For example, I look into his schoolwork and I try to see what they have done for the day. If they're learning the alphabet, then I make sure that when he comes home, if I'm back, I try to do the alphabet with him. Even his elder brother, who is also a kid, understands this, and he tries to do the alphabet with him. Even the nanny or my mom who lives with us, just anybody at home, you know, they understand the routine. So when he comes, we try to practice to, you know, make sure that the effect is there. Yes, we don't just, I don't just leave it in the hands of the school
or other people.
Yeah, it will be, you will not have the results. The results will come, but it might take too much time. It might take too much time. When you do it, you know, with the school, alongside the school, it becomes easier and they capture faster.
Now, you said, with his progress, you said he called you mama, and that's what no, to show that he's progressing. What are his strengths? What other things does he do to make you know that this child is progressing? He's not on the same spot.
Okay, I will talk about the potty training. Okay. This is a real area of challenge that parents with kids having disabilities have. So when my son was getting to 3 years, I was asking myself, for how long am I going to continue buying diapers? Sometimes the problem is not even buying the diapers because the means is there to buy, but it's kind of it's so embarrassing. You take the child out, the big boy, and the child
still wearing diapers.
You know. So I didn't know how to handle this, and I asked myself, should I pray, should I try? The more I try to potty train him, the more he becomes aggressive. So I just let him be. But believe you me, I sent him on vacation to my mom in Boya. This was at the verge of his third birthday. And one little girl in the house one day just called me and said, "Mommy, they'll come and see something." So my guy had gone to the bathroom and he took time to remove his trouser, remove the diaper and keep.
Wow.
And before then, I'd observed for like 2 weeks that he wasn't having wet diapers in the morning, because in the night I'll put the diaper and in the morning you'll be dry. Sometimes he even gets up from sleep, the diaper was not there. So I knew something was coming, but I wasn't quite sure. So when this little girl called me, I went and I spied. I said, okay. He did that repeatedly, and that was it. So that was how he stopped using the diaper. Then I knew that something had changed.
That was a great
and
move.
Before then, you know, I had been working so much on his diet, working on the diet, you know, trying to give him things that will help with the brain formation. And I think that also had an impact, you know. Now, my son, for more than a month now, going to 2 months, my son can wave.
Wow.
If you know autistic children, it is difficult for them to
wave, to say goodbye.
To wave. But I just realized that this boy, immediately you say bye.
Wow.
So this is since a month or two, and he can say bye-bye. Sometimes you need to prompt him, you know. They like when you reward them. He likes chocolate.
Like every child.
He likes chocolate. So when I want him to say something, I can say, Jaja is a good, and I want him to say boy. He will pretend like he's not with me, and I will hold the candy or whatever in my hand.
Let
and
him
I say,
answer
if
first.
you don't answer, I will not give you. And the next time you'll say, Jaja is a good, you hear him shouting, boy, boy.
Because he wants his candy.
So, yes, and when he does that, I reward him.
Wow.
Yeah, I reward him. And then his feeding also has improved. Today I don't have the challenge that I used to have before. My son could eat just one meal. Like if he says today or this month I'm going to eat fried potatoes, that is what he will eat every day, morning, afternoon, evening. You give something else, it's a problem. But I've worked that out to the point where in my home, what we cook is what he eats, and he eats just like every other person.
He has no problem.
He has no problem. He can feed himself. He can use a spoon. He can use a fork. I mean, he uses cutlery, and you just need to take tissue paper and put on the table, and he knows that you want him to clean his mouth, and he will pick it up and he'll clean his mouth. Sometimes he will keep back on the table or he will throw. But when he throws it on the floor, I say, go and pick it. Yes, and he goes down, he will pick, and he keeps it there, and he eats his food.
Wow. Yes. That's good. That's a great, you know, when you see your child growing like that, you know that, you know, he's progressing. Now, what do you have for parents out there, for mothers especially out there? Just reiterate again, what's your advice to mothers out there, especially my little friend who's faced with this problem?
What I would say to mothers out there is that the first thing is to accept that your child has a challenge. If you accept that your child has a challenge, then try to find out what that challenge is and what you can do to help your child. Love your child unconditionally, because nobody in this world would ever love your child more than you do. Yes, you are your child's teacher, you are the doctor, you are the caregiver, you are the defender, you are everything that the child depends on you for their well-being. So you can't joke with that. That is a life.
Yeah.
Some people out there are struggling to have a child, and you have one. So you have to thank God and do everything to support your child. Create awareness about your child's condition in your community, so people know that your child has a condition. And you can even teach them how to help your child, because when you create awareness around you, this awareness goes further. So many people get to know about the condition, and then it becomes something normal.
Yeah.
It becomes something normal. So if you see a child with a disability,
You
it's
know
not
that it's
something
normal.
that
Start
scares
thinking
you.
that, oh, it's witchcraft and
Yes,
all of that.
you start looking, you want to help the child. You want to help the child, or maybe any other person, because it's not only children. There are adults who live with them, who have autism and other disabilities. So that awareness changes your whole perspective and the way you approach individuals having this condition.
Okay,
And also, I wanted to say that we are living in modern times. So there are so many support groups for mothers who don't know where to go. Even on Facebook, I know so many people are on Facebook today. There are so many groups you can join. Mothers having the kind of challenge you have, and you people can share. They can share some tips on how to handle your situation.
I think that there are many sites that we can self-educate. You can go to Google. If you are faced with this situation, just ask, like you want to go to Google and self-educate, learn about the child's condition. And this helps you. And then you help other people in the society who do not know where to get help. There are just many avenues where we can get this information and then help ourselves. Let me take a few messages. This comes from Anita Eno. Now you know why I created the EAT Foundation. Children with autism must have balanced diet and food of their choice. She said it well. I'm sure she's referring to you. She said it well. Thank you, Mom. Go Autism Speaks. Cameroon Autism Moms Rock. Wow. She says, safety is #2. What does that mean? #2. I don't understand what that means. And then that is the #1 key. The child deserves all your love. Okay, probably Anita I know is another mother in the US who has an autistic child. Yeah, she has an autistic. I'm sure that's why she's reacting. Maybe Anita I know tell us what she means by safety is #2 and #1 key. I don't understand that.
Okay.
Madam Jochebed, just your last words on autism.
This to mothers with children with autism, and also to the population at large. Acceptance is the key. And first of all, when you don't accept that your child has a condition, you're actually building a world, but when you accept, that's the beginning of the breakthrough for the growth of that child. I want to say that children with autism are very smart. I know great people, great inventors, great scientists who are autistic, and we are enjoying lots of technology today because of autistic people, lots of autistic people, because of their ability to withdraw, they can think, they can come up with things and all of that. So maybe you're hiding that baby, whereas it's a baby that is going to do great things in the future. So I want to tell mothers to stop hiding their kids, to stop keeping them behind. Locking them up in the house. Let them send them out.
Because when you're doing that, you retard them the more.
Open up and talk about it. That's the beginning of healing for you. I know it's very challenging. Maybe educating a child with special needs. You are thinking about the financial obligations. You're thinking about also the medical bills is enormous and all of that. So, but step up and speak up. Accept it, embrace it, go for a diagnosis. That is when you start doing that, you start having help. And then talk about your child to like what she has done. Talk about your child to everybody. You need that support system, like what she said, and know that these children have a right to education. They can actually go to school and excel. Yes. They can write public exams and excel. Wow. They can do great things. Some may not be intelligent up here, but like reading and all of that, but they know they can do things with their hands, and also know that when you are hiding these kids, or maybe any negative thing you do to these children, they see it, they know it, they watch it, they see it, and it will either, it will either destroy them or make them to totally shut down from you, you know. So we have to learn to love them. Love your child. Love your child. And I'm not only talking to mothers, even teachers, even schools. In schools, you find teachers kind of insulting these children, telling them they are
even within stupid. The community.
Yes, you're stupid. You know, we have this word we call mumu, you know, or imbecile, and all of those things. We need to take out those words from our mouths. Nobody asks to have such a child. It can happen to you, it can happen to your sister, it can happen to your brother,
anybody.
It can happen to your grandchild or to anybody. You know, so let us embrace them, accept them, and together we build
a better society.
A better society, you know. Because they are, if God brought them in this world, it's for a reason. It's for a reason. So let's love them, let's fight for them, let's stand for them.
Let's love them, let's fight for them, let's stand for them. It's a wrap from us today, and of course, we have all heard mothers out there who are dealing with autistic children. They are not an ill omen, like some of us do think they are ill omen. You start visiting babalawos and, you know, people in the quarters and all. No, everywhere. These children deserve love like yourself. They didn't ask to be born that way, but they have been born that way. And of course, all we can do for them is to give them the love that they deserve, like every other child in the community. And when we do that, when you give children love, they grow up happily. You adore them. There are some children who have grown up without ever receiving a hug from a mother, without ever receiving a hug from anybody. And they just, they don't receive love. And sometimes children tend to go their own way because they can't receive love from a parent, from people, and they just behave funny. So we are called upon as parents, as caregivers, to always embrace these children, whether they are autistic or normal children. You have to. They deserve to be loved as children because they didn't ask to be born. It was a wonderful program. Thank you, Madam Jochebed. Thank you, Madam Delphine. And thank you to our televiewers and those of you who participated. Until next week, it's bye from us. You stay blessed.
Welcome to a new world of TV broadcasting. My Major Prime. News, discovery,